Hi everyone. Today I'm going to discuss about antibiotics. It is a very important topic in the healthcare. If we are walking in as a doctor or a medical assistant or nurse, we should know about antibiotics to be a better god, as in advocate for the patients, at the same time educate them. So I have highlighted some important points where you can come across this in the daily conversations such that you can uh, know what antibiotics mean in a nutshell. So we all know antibiotics are very powerful tool in the healthcare. However, we need to know when exactly to use the antibiotics and if it is appropriate to use in certain situations. So, antibiotics, when used inappropriately or for a longer duration of time, there is an increased risk of resistance. Resistance, meaning the bacteria has adapted into that environment, and when this antibiotic is given, the bacteria is just not responding to that particular antibiotic and then ends up into resistance. So many antibiotics can also lead one to develop resistance. So what we have to do, what are the factors that are taken into account while prescribing antibiotics is what we will be looking at. I have highlighted all the key points that I will be discussing. So initially, since this is the global issue, a threat, especially while we are using antibiotics, we need to address the resistance part. Um, there are two types of antibiotics. One is the cidal, and the other is static. Cidal is, you can think of killing the bacteria. It's going to target the cellular structure and also the entire processes that contribute to its cell wall synthesis. So, this is used in severely infected individuals and those whose immune system is weakened. Next type is the static type. Static means it is going to stop or inhibit the bacterial growth, allowing our immune system to clear away the infection effectively and at a faster pace. So, when is this being used? This is used especially when our immune system is intact. It needs some level of immune system to work in conjunction with these antibiotics. It helps aid the process of producing that particular effect. Now you know the difference. You need to know when we are using the static ones and when we are using the cidal ones. So coming down to when it is being effective, when is it going to be effective? So it can depend on several factors. One is the patient factor, that is either the age, gender, and it can be the health status, the immune status of the patient, and it can also depend on the degree of infection. So there are so many factors that are in place before prescribing this. Next, coming down to the causes of resistance, this part. Why is this causes of resistance and how do we prevent it? Now, the causes can be, like I said, it can be that the bug is just not responsive to the antibiotic, or it can just be because the person has been exposed to multiple antibiotics. So, the way we can prevent this is by looking at the type of antibiotic we are using. There are drug classes which include cephalosporins, penicillins, macrolides, a wide variety of drug classes. Now, each one of these interfere with DNA replication, cell wall synthesis, protein synthesis. So, depending on what kind of antibiotic we give, um, is very important as well in contributing to the resistance. Firstly, if you think about macrolides, these are those antibiotics given to people with allergies to penicillins. So there is always like the alternative antibiotics and first line antibiotics. So other than this, the way we classify the antibiotics um, is like the broad spectrum antibiotics, or it can be a narrow spectrum antibiotic. Broad spectrum meaning it's going to be acting very weirdly all across, widespread, and mostly it will cover up almost all the bacteria. You can think of a normal flora as well in this process. So it is given in classic situations where we have not done any lab work and we don't know what pathogen it is. Um, but narrow spectrum antibiotic, meaning this is that medicine that will target one particular bug at a time. And it is highly specific in its target, meaning it will preserve the normal flora as opposed to the other class of drugs. So, this is something very important, I felt. And some other points that I want to cover here is we we are bound to know about antibiotics. The reason is it has been transforming in the healthcare. We are using it broadly prior to surgeries. It has been playing a good role in reducing that morbidity and mortality. And so, having a wide, in depth knowledge of antibiotics actually helps in various um, departments and fields of medicine. So, that is it. And know the drug classes, okay, and know the medications, action, mechanism of action, as in it's very important. Now, let's say, think about penicillins. Penicillins, you can think about cell wall synthesis, it's targeting that particular thing. Macrolides, protein synthesis, cephalosporins, also something that is dealt when there are infections to penicillins. Okay, fluoroquinolones are very broad spectrum too. They are mostly against gram negative organisms, and the mechanism is by um, interfering with the bacterial DNA synthesis. And so we need to be very careful with this since there are a lot of side effects. And one of the side effects in terms of USMLE, we need to remember that we are not prescribing to individuals over 65, as there is increased risk of tendon rupture. Next class of drugs would be doxycyclines. This is going to inhibit the protein synthesis as well. Just to know that it's used broadly for respiratory infections, acne, uh, and tick-borne diseases. So overall, you can just learn it broad and just remember why we are using these medicines. So that will be more than enough. And um, I've talked about the broad spectrum and narrow spectrum when we use that versus the other class. So Yes, when we talk about the resistance, the one thing that's happening is the bacteria that is lodged in the blood vessel or in the heart, in the kidneys, or in the anywhere across in the body is not responding. And the reason could be it developed resistance because the patient did not comply to uh, the routine full course of the antibiotics, or maybe the patient underused or did not use at all. So, um, it is very important to educate individuals on how to use the antibiotics. And it is a shared responsibility that not just emerges from the doctor's point of view, but also from other healthcare staff. So, resistance is like a common problem encountered by everyone. So it becomes a very much like a common ground where everyone have to go teaching about this. So it's very important on uh, emphasizing the importance about using the antibiotics in the right way. One of the most important rule that you would tell to a patient who is prescribed antibiotic is think of it as never, never, never. Okay. Never stop the medications early, never share the medications, and never save the leftover medications for future use. So, these are the 3 points that you may want to explain to your patients. Um, you should always promote conversation from the patient. Allow them to tell what is their problem. Whenever the antibiotics are prescribed, it needs to happen in a full term course. They need to finish that full term course as prescribed. And um, it is very important to keep up with side effects. However, before talking about the side effects, we want to know when exactly we are using antibiotics. So, this was one point that I had to keep it to the last because many times we end up prescribing antibiotics. Now, there are situations where antibiotics are just not the right drug. They're ineffective. They serve no purpose, no benefit. So, these conditions include common cold, some cases of bronchitis, COVID-19, influenza, all of which are viral infections. So, antibiotics do not work over there. And so, it is very, very important to educate patients about this. Okay. So, that's about it. Adverse events can be anything: stomach upset, diarrhea, mm, all those kind of stuff. But the important stuff is rash, development of common cold, or respiratory problems, heart rate going high and low with one particular antibiotic. All these need to be monitored, documented, reported immediately, as these can be alarming for the patient. Um, in some cases, they may need immediate admission. So I hope I covered all the points related to antibiotics. I know it was pretty basic, but I think we need the reasoning behind why we have to read about antibiotics. And this video serves that one particular purpose. So, if this purpose is motivating enough, you can simply delve onto antibiotics in a deeper side. on a much deeper level. So, um, I would really encourage you guys to simply share my work, especially with the pre med students, because they are just starting out. And this video was pretty basic on what is an antibiotic and how we are prescribing it. It will also be of importance when you are working and healthcare, as in advocating or talking to the patient about these kind of situations. So overall, I'm aiming to promote my content. So please do like and do share my work. I hope it has been useful to some extent. And thank you very much for viewing my video. I hope to see you on the next video. Until then, bye bye and take care.